Hello, and welcome to Module 2, The Benefits of Breastfeeding and Nutritional Needs During Lactation, presented by me, Victoria Luera, a registered and licensed dietitian in Texas. First, we will start off by talking about the benefits of breastfeeding for baby. Breastfeeding decreases the risk of ear infections, asthma, lower respiratory infections and difficulty breathing, diarrhea and vomiting, childhood obesity, eczema, type 2 diabetes, childhood leukemia, and sudden infant death syndrome, also known as SIDS. Breast milk is packed with nutrients such as vitamins, minerals, prebiotics, and probiotics, as well as several other unique properties that we'll talk about on the next slide. Breast milk is easy to digest and can aid in the development of the digestive system, and breast milk is free, and babies who breastfeed generally get sick less often, leading to lower healthcare costs. The composition of breast milk changes as the baby grows and/or as they get sick to help fight infection. Essentially, breast milk changes to accommodate your baby's needs, something that formula can't do. Lastly, breast milk is convenient, warm and ready to go whenever the baby needs it, which is super helpful if you have a crying baby at hand. Here we have a model showing the differences between formula and breast milk. While formula has everything your baby needs to live, thrive, and grow, such as water, protein, carbohydrates, DHA and ARA, fat, vitamins, minerals, and some formulas may even have prebiotics and probiotics, we can clearly see who's the winner. Breast milk has additional properties that can't be replicated, such as anti-parasites, anti-allergies, antiviruses, hormones, disease-fighting stem cells, enzymes, growth factors, anti-cancer properties, and antibodies, and these are the only known benefits. Scientists are continually discovering new properties that just proves why breast milk is best for baby. Benefits of breastfeeding for mom. Breastfeeding helps the uterus return to a normal size after birth. It helps decrease bleeding after birth and promotes weight loss. It allows mom and baby a special time to bond, and benefits can still be seen even if mom and baby are not connected at the breast and mom is pumping milk. Breast milk reduces the risk of arthritis, high blood pressure, breast and ovarian cancer, and type 2 diabetes. In addition, there's less prep time needed for breast milk when compared to formula. Working moms who breastfeed tend to miss less days at work since their babies don't get sick as often, which is an added bonus. There are additional needs during lactation, such as energy needs. An extra 330 calories per day is recommended for breastfeeding moms during the first 6 months of lactation, and this increases to an extra 400 calories per day during the second 6 months of lactation. Continued use of a prenatal vitamin may also be beneficial, or a multivitamin, especially for mothers who are vegan or vegetarian. However, some nutrients such as iron and folic acid may be consumed in excess, so it is best to consult a doctor before continued use. Minerals such as iodine and choline are also needed in greater amounts during lactation. Iodine can be found in dairy products, eggs, seafood, or an iodized table salt, and choline can be found in dairy and protein food groups such as eggs, meats, some seafood, beans, peas, and lentils. Lastly, fluid needs are increased to about 16 cups of water per day to aid in the production of breast milk. As mentioned on the previous slide, additional calories are needed per day during lactation. However, this is not a great amount, and just like with pregnancy, it equates to about 1 to 2 small snacks in addition to a normal dietary pattern. Examples of 330 calorie snacks during the first 6 months of lactation include a cheese stick, a 4th cup of almonds, and a cup of blueberries, or avocado toast consisting of half of a medium avocado and an over easy egg on 1 slice of whole wheat bread and a small orange. Examples of 400 calorie snacks during the second 6 months of lactation include 2 cheese quesadillas on corn tortillas and 2 tablespoons of salsa, or a tuna packet, 1 cup of papaya, half cup plain hummus, and half cup baby carrots. Here's an example of the 5 different food groups and the amounts needed when moms are breastfeeding, exclusively breastfeeding, as well as doing a mixture of breastfeeding and formula. We can see that in the breastfeeding only category, the needs are similar to that of moms who are in their 2nd and 3rd trimesters. In this category, moms need about 2 cups of fruits per day, 3 cups of vegetables, 8 ounces of grains, especially those that are high in whole grain and fiber, 6.5 ounces of protein foods, and 3 cups of dairy. Whereas the breastfeeding plus formula category is similar to that of pregnant moms in the 1st trimester, needing about 2 cups of fruits, 2.5 cups of vegetables, 6 ounces of grains, 5.5 ounces of protein foods, and 3 cups of dairy. Again, this is just a guide. Moms may need more or less depending on their pre-pregnancy BMI, how much weight they gained during pregnancy, and specific weight loss or weight maintenance goals after pregnancy. If moms have any questions about certain foods or what they should consume, they should consult their primary care doctor. And on the side, we see that different fruits and vegetables, grains, proteins, and dairy come in different sizes, and these are examples of what serving sizes are. If you need a minute to pause the video now to continue looking at this chart, you can. Lastly, these are continued nutritional recommendations that carry over from pregnancy. Moms are encouraged to continue to eat food from all of the 5 different food groups following the plate method, such as half of the plate with fruits and vegetables, a fourth of the plate with grains or starchy foods, specifically complex carbohydrates, a fourth of the plate dedicated to a lean protein source, and a serving of low-fat dairy, such as a cup of milk. Moms should eat roughly between 3 meals and 2 to 3 snacks per day, but again, this may vary depending on the mom's schedule and preference. Physical activity is also recommended for most people. At least 150 minutes per week of moderate intensity physical activity should be achieved, which equates to 2.5 hours, or 75 minutes, also known as 1.25 hours of vigorous physical activity. However, if moms have any question on their ability to perform physical activity, they should consult their physician. Women should wait at least 6 weeks if the baby was delivered via C-section before beginning any type of exercise routine. This concludes the module on benefits of breastfeeding and nutritional needs during lactation.